Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today we're talking about the concerns of joint replacement surgery. Can you talk about the difference between anterior versus posterior procedures for hip replacement and why one might be better than the other?
If you look at any hip replacement, no matter how it's done, there's three main ways: through the front, anterior, through the side, lateral, and through the back, posterior. At 1 year, people are doing very well no matter how you do the surgery. Research has shown at a couple months after surgery, people that have it done lateral oftentimes will be a little slower in their recovery than anterior or posterior. But I think if you look at it the long term, they're doing equally well no matter what.
Is there a way to prepare for hip replacement surgery?
It's good to keep moving, keep walking, strengthening the muscles around your hip and even your heart by doing cardiovascular exercise. All those things will help you to recover from surgery afterwards.
What actually happens during the procedure?
Either you have a spinal anesthesia, which means you're numb from the waist down, or a general anesthesia, so you're asleep and a breathing tube is in place. Basically, the ball is removed from the end of the femur and a new socket is placed, which is titanium and a very special plastic. And then a new ball is placed on top of a stem that goes actually inside the bone. And that ball can be either made of cobalt, chrome, or ceramic. Basically, that replaces the worn-out ball and socket.
How does age affect a joint replacement procedure and recovery?
Age is mostly a number in that, some patients are healthier than others. So there's no reason not to do the surgery as long as there's arthritis and pain associated with it. But, generally, if people are healthy, no matter what their age is, they can recover from the surgery well.
Will I need another replacement if I get it when I'm young?
These implants that we have today, probably 95% of them are still functioning well at 20 years. But if you have a replacement when you're young, you may need to have it replaced again in the future. And you can have it done more than once, although the more surgeries you have on the hip, the more complicated things get and the tougher the recovery can be. Truthfully, research has shown that the best place for you to recover from surgery is back at your own house. You're up, you're getting food, you're getting drinks for yourself, you're walking around, you're doing the exercises that you need to do just by getting up and moving around in your house, and you're surrounded by your own germs, so it's really a better place for you.